Leila Turner with Living Wellness Medical Center, and I have Dr. Lori Brouwer here with me today. We've collected some questions about pellet therapy, and I have some questions I'm going to read, and Dr. Brouwer is going to enlighten us on hormone replacement therapy regarding pellets. So number one, what makes a patient a really good candidate for pellet therapy?
Really, choosing to do hormone pellets as the delivery system for pellets is just a personal choice. You can use, capsules or troches, lozenges, creams, all sorts of different ways, but people that really like to do the pellets, it's mostly convenience. It's a very convenient way to do it because you get a pellet placed once every 3 months instead of having to do something every day. I think a good candidate for testosterone replacement therapy. So a good candidate for testosterone hormone replacement therapy through pellets would be men who are over the age of 40 or with low testosterone levels, or women who are postmenopausal or even in perimenopause. So before our ovaries stop making hormones altogether, we can still use testosterone pellets effectively.
How long do the pellets last in a male versus a female?
They're still around 3 to 4 months for men or women, and they can be used up faster if you're very athletic and very active.
Okay. What are the different types of hormones that you can get in a pellet?
Well, the pellets that we do here in our office is we have estradiol, which is the estrogen that's most commonly used in hormone replacement therapy, and testosterone.
If a woman has been on hormone replacement therapy already, can she transition from some sort of hormone replacement therapy like a cream or a troche or a lozenge and switch to, say, pellets?
Certainly, yes. For estrogen or for testosterone, but not for progesterone.
Meaning progesterone?
Meaning progesterone needs to be taken orally. It doesn't go through the skin well, so pellets are considered a topical application because the hormone is picked up through the blood vessels of the skin and then distributed. And progesterone just doesn't go through the skin very well that way.
Okay. Can you describe the procedure of putting in the pellet?
Yeah, definitely. It's a really easy procedure, outpatient, done in our office. Probably takes 15 or 20 minutes to do. The only thing we need to know before we do it with somebody is if they are sensitive to lidocaine, because that's the numbing agent that we typically use. So we would just inject a little bit of lidocaine under the skin and make a tiny little incision. It's about 1/4 inch long, very small. We put the pellets in subcutaneously, meaning that it's under the fat, very deep under the skin. So normally you're not going to feel it at the surface because it's very far down in there. We put the pellets in, and then we tape the area shut with steri strips. So really simple, really easy. As far as the pain level of it, which is something people often ask about, I think the worst part of the procedure is the numbing, because lidocaine can really sting as you're injecting it.
Little bee sting.
Yeah, so you've got this little bee sting, which you're familiar with if you've ever had numbing, at the dentist's office. That's the same thing that they use. So it's easy, it's simple. For the aftercare for it, or what people need to know, is when you're going to get your pellets done for the next 3 days, you're not going to do any kind of heavy duty exercise, because where we place them is right in the back, above the hip, sort of in that little fatty area, the kind of a muffin top area. And so that area is right over your gluteus muscles, which are, your butt muscles. And when you're exercising, doing squats and lunges, or, biking, or, steep hiking, that's going to irritate it a little. So for 3 days, no heavy duty exercise, no, intense yoga. But that's really the only restriction to know about.
And then the question about pain, which you already answered during the procedure. What about pain after the procedure? Is the pellet something that will hurt later?
It really shouldn't. Yeah, if we get the placement right, it's going to be in tissue that's pretty undisturbed. I'm putting a foreign object into your body, so of course your body's going to have a reaction to that. It's going to send some healing that way. So you'll have a little tenderness, maybe a little tiny bit of swelling. It shouldn't be hot. It shouldn't have any kind of redness reaction. That would be bad. But normally it just, after a couple of days, even that little bit of tenderness goes away. Actually, I just had a patient today. It was interesting that I did her pellets, and she said how comfortable that it was getting it done in our office, that she's had it done elsewhere, and that she had pretty severe pain for 4 or 5 days afterward, and that's just not my experience. I've never had that happen. So the technique placed correctly, done right, you shouldn't have pain in the next days other than just a little tiny bit of bruising.
Okay. So if you're interested in hormone replacement therapy, or if you have questions about pellets, please give us a call. We all offer a free 10-minute phone consult, and we would be happy to chat with you. Take care.